Hey, everybody. Welcome back to another episode of the Horse Geeks podcast, where we look at horses and riding from the inside out. I'm Kirsten Nelsen, professional horse trainer, and with me is my co-host, Deb Romero, certified Alexander Technique instructor. And today's topic is a little bit of a continuation of what we've been talking
Mhm.
about. So we're calling the topic Seeing Muscle Use in Horses because kind of determining basically from what we can see and also what we can palpate, we can really assess how the outer muscles of the horse are being used and what kind of information that tells us about the skeletal coordination. So whether it's a supple muscle or a chronically contracted muscle, both of
Mhm.
those uses of the same muscles give us a lot of information.
Yeah, I
And
like looking at is the muscle, same in people, is it available for proper use?
right. And so how would you know if it is or isn't?
Right. What are you looking at? How would you know that what you're seeing is this an available muscle? Is this muscle already in tension and bad use?
Right.
Yeah.
And to take kind of a big picture view, when I first meet a horse, I'm kind of downloading quickly. Is the front end more muscled and developed
Oh,
compared to the hind end? So if I mentally kind of divide a horse from a side view, if I kind of divide them in half at the saddle, then is the front half really well developed and well muscled compared to that same horse's back half,
I do the
right?
exact same thing. I compare, are they equal also? Like, is the front end real heavy?
Hmm.
And then everything narrows
To the tail.
to the tail, and
Yeah.
I just look at it, because to me it should be more equal, like the length of the neck should equal the length of the torso kind of thing.
And that's actually kind of a confirmational point where people will say, my horse has a short neck or a high
Mm-hmm.
neck set or things like that. But
Right.
good coordination is always going to develop a symmetry of the muscles throughout the body. And so the neck looks like it belongs with the back. The front half looks like it belongs or is congruent with the back half, or
Right.
vice versa. So when I see a hindquarter that looks like it belongs to a different horse than the front end, I go, that already tells me coordination is dysfunctional.
Exactly.
I don't know the details yet, but I go, okay, we can get into the weeds, but I know the horse is moving in a way that they're having to compensate with their front end and they're underusing the hindquarters and
That
the
is
back.
such an important point you said. It's not good coordination. It has nothing to do with conformation.
Right.
It's
Because,
the coordination of the use, just like in people, that makes the difference.
right. So conformation is so often blamed in for horse with horses
Hmm.
for a lack of athletic talent, for the body looking like it's made out of spare parts, for, that short neck, long back, or even the high-low hoof growth syndrome. People say it's all conformation. But
Wow.
you and I have witnessed
Mhm.
personally how the appearance, the outward points on the body, and the relationship between the neck to the back or the hips to the hind leg stance or the shoulders to the front leg
Mhm.
stance, all of that can be changed by altering coordination.
Yes.
So, and I think what's important about just mentioning that is conformation is an unchangeable thing.
To me, conformation is the skeleton.
Yes, it's the
And
size of the
there's,
skeleton. I
yeah.
go, it is what it is, right?
You've got usually the same amount of bones, unless you've got an anomaly of some sort of degenerative growth pattern. Everything for most people and animals, it's the conformation is the same bones, the same lengths of
Yeah.
bones.
Same anatomy, right?
Right,
And so whether we're tall or short, that's the conformation,
right.
right? And coordination is the positional use of the conformation. So
Yes.
coordination changes all the time, and good coordination can actually improve or change what we usually measure as conformation.
Yes.
So I go, conformation, we only recognize it as a series of relationships of body parts,
Hmm.
right? But that relationship of body parts changes when we change coordination.
Yes.
So I go, how can you say the horse is stuck there, right? The skeleton can constantly adapt their entire life.
Yeah,
So
and I remember you saying once or several times talking to people about horses sometimes can't get lower their head and neck, and you always respond, well, are they eating grass?
no, and
Cracks
that's
me up.
when people are told under saddle, my horse can't go to long and low during work because they have a high neck set.
Yeah,
And that
hear that a
high
lot.
neck set is such a and it's kind of taught to people that it is a conformational point that
That's
the horse has a
hmm
high neck set, which translates in our brain to unchangeable.
that's a good point. We think it's
Unchangeable,
unchangeable.
right.
Exactly.
And I have to kind of shake the brain a little by going, does that mean your horse can't graze? Like,
Love that.
because if that were truly a conformational point,
Hmm.
then that horse would need very tall grass to eat. And I go,
Sure.
but they put their nose in the dirt just the same as every other horse,
Right.
right? So it just isn't, it obviously isn't a conformational point because it can change. So it's a coordination. And a coordination can become so habitual that the
Oh,
muscles develop to support it. And that's kind of what we're talking about, looking at muscle use. Muscle use is always developed around the precise coordination of the skeleton. So, however, the skeleton is coordinating, right? And that doesn't depend on conformation. We all have the same skeleton,
hmm
but how we use it most of the time, how we coordinate movement most of the time is what makes some muscles strong while other muscles atrophy from a lack
exactly.
of use.
Hmm.
So a horse with a huge front end compared to their own hindquarters, when it looks disproportional, that means the skeleton is organizing movement from the front end and the hind end is kind of being pulled along.
Like the choo-choo train.
Yeah.
The engine's
Yeah.
in the wrong place.
Yeah, the engine is in the wrong place. The caboose should be back there,
Yep.
right? So that muscle, overall picture of muscle development kind of gives us a picture on whether that skeleton is really being used efficiently or inefficiently, whether it's
Hmm.
being used according to its design or there's some pattern of compensation and dysfunction going on. And then I
Yeah.
can even kind of look at the distance, say, between the left and right front legs, between the left and right hind legs, because that muscling, the leg stance is like the width between the legs
Mhm.
is mostly controlled by what we call oblique muscle groups, right? That
And
are
that's a great point to bring up because we usually think linearly, but these are three-dimensional. And if you break down just anatomically, I'm sure it's the same in horses. There's transverse and oblique muscles running everywhere. The body loves
those
up,
sideways
down,
muscles.
sideways. I call it your pockets down or your pockets up muscles. That crisscross, that's the level of support
Right.
for for organization. So it's not a linear thing. We are three-dimensional,
And
cylinder-like.
don't most muscles from the insertion to the or attachment to the insertion, none of them travel in a linear straight line. There's always a bit of a curve. to every
That
muscle.
I'm not real sure of. I know what they're taking out of anatomy now is origin and insertion. We used to think that the muscle contracted from the origin to the
Mm.
insertion, which they're finding that is not true.
So it's
So
that whole tensegrity system
yeah, it's a
of
whole
everything's
tensegrity
connected.
depending on function. So yeah, and the body loves that layers of support that crisscross each other
Mm.
in a like a weaving pattern.
Interesting.
Yeah, so if we can try not to think of this as a linear movement, that, we really need to bring in the adductors, the abductors, the oblique muscles. I mean,
Right. So
all of
when
that.
those transverse and oblique muscles are sort of fulfilling the role of stability because the limbs are trying to stabilize the body, which tells me the axial skeleton is not stable, right? The
Right.
skull, spine, and pelvis is meant to be the most stable part of the skeleton.
Hmm.
So if that part of the skeleton gets a little unstable, then all the muscles instantly fulfill the role of stability by contracting excessively. So when we get tight oblique and transverse
Mm.
muscles, I find the horse's legs decrease distance.
Yeah.
So the horse's front legs become what we consider another conformational point, base
Hmm.
narrow,
Right.
right? But I go, how can a horse be stuck at base narrow if their front legs are hanging in soft tissue? Like that can't
Well, obviously
possibly.
through habitual muscular patterning.
Exactly. So
Yeah.
it can't be a conformational point because the
Mm-mm. Because
skeleton
the
is
bones are
never,
the bones. The
the
bones are the
bones are the
bones.
bones and they're not stuck there because they're in a sling of soft tissue. So I go, that whole thing about a horse being base narrow, I go, that's a muscle use. That's
Right.
not a conformation or skeletal point,
And I
right?
think the big one that I see is a horse in extension, upside down.
Well,
As
and when the back drops, like horses cannot shift weight very far up or down
right.
without it having a major effect on their balance and body use. I mean, for us, it's more we can't shift very far left or right or forward
Hmm.
or back before we would fall.
Right.
Horses can shift a lot front to back and substantially left to right. But if they shift weight up or down a little bit, it's a big deal.
It's a big deal.
Yeah. So when we see base narrow legs, whether it's front legs or hind legs, that downward weight shift creates a lot of excessive contraction, particularly in those weaving, crossing
Hmm.
muscles to create stability for the body.
Hmm.
And it will pull the legs in closer. So the hind legs are connected skeletally to the pelvis, right? So the hind legs instead, they do get narrower if those oblique and transverse muscles get really tight, but they can also sort of like the hocks can turn in. We call it again a conformational point. We call that
Hmm.
cow hocked, right?
Right.
So the hocks can kind of aim at each other or they can be pointed outward. So the whole leg, all the leg bones are kind of rotated in or out. And we can have what's called functionally straight hocks, where the hocks don't
Hmm.
bend, or functionally sickle hocked, where the hocks don't extend. So all of those are considered conformational points. But I go, if you change the muscle use,
Hmm.
by changing the skeletal use, then the legs change how they're organizing. And
Yeah,
that's
and
what
we're
makes it,
working with a horse right now with that. So we know
yeah,
my guy Milo with Sickle Hawk. I think he's looking better. We're 3.5 months into it and making changes in his coordination.
yeah. And my horse was what was called functionally straight in the hocks. So his
Hmm.
hocks didn't bend. And I go, now they bend, but we had to knock some rust off of those joints and
Yeah.
kind of carefully restore the functionality of the hock
Hmm.
by addressing the use of the axial skeleton. and letting the hocks regain that functionality little by little. So when we look at muscle use, it's also our way of determining the skeletal coordination because certain muscles, depending on how the skeleton's used, certain muscles will strengthen, and even the deeper core muscles that we can't see, we can sort of assess by looking at the outer muscles on the horse's body whether they're supple or whether they hold chronic contraction
Hmm.
tells us a lot about what the core muscles are doing that we can't possibly see or palpate.
Right.
But the use of the outer muscles can tell us the story.
Yeah.
So, like for example, when we see a horse with a lot of muscle definition, which just looking at the horse, we see that sculpted body, right? That we associate with a really strong athlete or a good bodybuilder. And the fashion in the horse racing, thoroughbred horse racing, is race fit means a horse looks like a greyhound
It
to me,
does. I completely agree. They're
right?
completely on the forehand.
Well, and that greyhound look and the muscle definition where we have what we call an apple butt, where there's a little gluteal muscle that kind of
Hmm.
sticks up on top
Two
of the
bumps.
hindquarters, or what we traditionally call the poverty groove on the back of a horse's hind leg, that
Hmm.
deep um, kind of groove between usually there's a muscle either side of the tail down the back of the hind legs, which is
It's
actually
the
their
hamstring.
hamstring.
Hmm.
Yeah. And so what we call the poverty groove, because that groove gets deeper when horses lose weight, and it's supposed to disappear when horses gain weight. So
Interesting
that's why
theory.
it was called the poverty groove. And even if a horse is well fed, that groove getting deeper is just telling you how much chronic tension is being
Hmm.
held in the hamstrings.
Yeah.
So as the hamstrings get tighter and tighter with more chronic contraction, that groove gets deeper and deeper.
Yep.
So a lot of horses that are in dysfunctional skeletal coordination will have lines of definition through the hindquarter,
Hmm.
or the hindquarter from a side view will appear angular with kind
Good
of
way to
high
put it.
high
Yeah.
points rather than round like a beach ball.
Yeah.
So good use of the skeletal bones in through the spine and the pelvis will develop muscles that give the appearance of a big soft beach ball to a horse's hindquarter. So if it's anything less than that, if it has high spots and low spots and points and angles and dips, that tells me the pelvis and the lower part of the spine are not in a good coordination.
Yes. I agree because I see that. And a
And
lot of the dipping of the sides of the hip, I see a lot of, which that to me is a lack of adduction, abduction,
or too much
too
because it can
much.
it can get tight and give that sunken in.
That and it looks sinewy is.
Yeah. So it actually right around that area that will sink in, it's just above the stifle, kind of between the point of the hip joint and the
Mm-hmm.
stifle.
Mm-hmm.
And that area of the horse's hindquarter, there's a big muscle there. And I always say this wrong, so bear with me, but it's the tensor fasciata or tensor
Tensor
fasciolata,
fasciolata.
that muscle.
Tensor
So,
fasciolata.
so where is that on the human?
Oh, it's real easy. It goes from the point of your hip. It's a very short muscle. It's only like 3 to 6 inches long in the human.
Ah.
And it keeps you from, I call it the baby on the hip syndrome. You know, you how you put a baby or something on your hip and you cock it.
Uh-huh.
Well, it keeps your other hip
From
from
flying away.
flying out because the tendon goes from right below that, about 4 inches below your hip, all the way down to below your knee.
Oh,
That's the
wow.
IT band. That's the tendon. And I see a
Oh,
lot of tendon problems in high level athletes, 100 milers, things like that, that are imploding the ground a lot because people don't really think about, left right support of the hip. But I don't know what that's like in horses, but in people, it's a big hip stabilizer left to right.
oh, that makes sense. So it must have a very similar function for horses because when it's weak, when that hollow is there rather
Mm-hmm.
than being big and round, the horses tend to either cross the midline with their hind
You're
legs
right,
or they get
right.
wobbly in their hind legs.
Yeah.
And they kind of lose control over the flight path of the hind legs.
Yes.
And it also can become very tight. And sorry, it's one of the major muscles in horses that helps them bring the hind leg forward closer to the center of the body, which is what we call engagement of the hindquarters, right? So it's related to stabilizing not only laterally, but sort of stabilizing, I guess, weight or giving resistance to their own body weight from overloading their own front end. And so it's when that muscle is weak or that IT band, sometimes on a horse you'll see it
You can
like
see
a
it pop.
like a tight rubber band
Yeah.
that
Mm-hmm.
stretches and gives and stretches and gives. And when you can see it visually while the horse is moving, that thing has just been wicked tight for a
A
long
long time.
time. Yeah. It's
Yeah.
and that will restrict both the lateral stability as well as the forward
Mm-hmm.
placement of the hind legs. It just restricts it. It becomes impossible because that muscle,
Right.
every time it tightens, it's pulling the hind legs backwards as well as kind of
Mm-hmm.
destabilizing them left to right. So that's a muscle we can see from the outside when a
Yes.
horse is moving. And if we can see it, it's already tight.
It's a problem.
It's a problem, right? If
Sorry.
if we can't see it or there's no hollow on either side of the hindquarters, then the muscles are probably being used correctly.
Yes.
If it looks more like a beach ball than an angular structure with high
Mm-hmm.
spots and low spots, it's probably being used correctly.
Yeah.
And then
And
if we,
although I love body workers because they give me a lot of information about how to change my training.
Mhm.
I also, this is my thinking as with the education I have to this point is you have to change, and this is with humans, you have to change. You can have a massage all you want, but if you don't change the way you use yourself,
Yeah.
that tightness is not going to go away just from a massage. That's what I found in my 35 years of practice.
Yeah, and what I see all the time is people are hiring massage therapists for their horses,
Mhm.
trying to get, and it does give the horse comfort to get a massage. It
Give some
feels good.
relief, but we're
It
not
gives them
changing
relief.
coordination.
But the training is the last freaking thing people want to change. I
Totally
go, they
agree
would
with
much
you.
rather hire a massage therapist than change how they sit on a horse or how they train their horse.
Don't get
And
me on that track.
I know. So it's like
Another day.
every time the skeleton adopts the same coordination, you're going to
Mhm.
create the same tension in the same soft tissues
Exactly.
over and over. Yeah, so if you don't change the coordination, you can massage the muscle weakly
Yep.
and it will never really restore to an ideal function.
Mhm.
It will
And
remain tight.
it's not like you can just tell the horse, look, this is really tight. You need to figure out how to change that. It's our responsibility
Yeah. Yeah.
to help the horse change their coordination.
And that's why sometimes horses that have had a long bout of resting
Mhm.
will come back to work better
Yes.
because if they're not being influenced by a rider or trainer, they'll start to seek relief to that muscle tension in their own body. Now, they won't completely find ideal coordination without guidance. None of us do. And that to me is the purpose of training correctly,
Right.
is to guide the skeletal coordination, which then relieves chronic muscle tightness, alleviates pain, can overcome a lot of lamenesses, and that's the power of it. And the muscles change as the skeletal coordination changes
And
at the very same rate.
it's like people when they get an injury go to a physical therapist, and that limb usually works better
Than the other one.
than the other one. Because unfortunately in PT, they don't rehab the whole body, they only rehab parts.
Right.
So, but as an Alexander teacher, we are rehabbing the entire system.
I think even medically, horses are looked at the same way. Like I have to fix the
Mm,
lameness on this leg. That's the problem.
right.
That's
Instead
the
of
repair
changing
job.
coordination so there's not as much pressure on that limb. Right.
Right.
That's a different way of thinking for sure.
So if we go from the hindquarter and kind of move our way up into the horse's barrel, there's things we can observe in the horse's barrel. And one of the things I find fascinating is horses that get labeled as hard keepers that just don't seem to
Hmm.
put weight on no matter what you feed them or how you adjust the diet or the supplements. They have a hard time putting on weight. Those horses usually have a lot of chronic muscle tightness around the whole barrel, which is going to include all the
Interesting.
back muscles as well as the inner, the serratus muscles, the abdominal muscles. They're just constantly contracting on the outer layer so we can see the definition of the ribs. And they get that greyhoundy sort of tight ab wall. And what that's telling us really is that the much deeper core muscles have become weak. So if they're not using their core muscles, just like if we don't use our core muscles, the excessive the lack of stability, because the core muscles are meant to keep the axial skeleton stable. So if they're not working or if they're not strong,
Hmm.
the outer muscles, particularly around the torso, have to constantly excessively tighten or they, fall over.
And that's a great
So,
point because in humans, that we've talked about the stabilizing muscles and the mobility muscles. And if we're using the mobility muscles to stabilize, that's a big problem.
yes, and that's what horses do all the time,
Yeah.
right? And so we'll see, like that to me is a major issue with coordination. Horses that look like that get called
Hmm.
hard keepers. I
I
go,
can't get weight on them.
right, they have now
Hmm.
are maximizing that muscular energy in the outer muscles that we
For
can see.
stability. Hmm.
And I've literally taken horses like that, like it's very typical with off the track thoroughbreds. And when I did some work for a rescue organization that only took off the track thoroughbreds, I would sometimes work them on the long reins, which really is a quick way on in the groundwork to stabilize the axial skeleton, at least laterally. And during the work session, anywhere from 30 minutes to an hour, that horse looked like they gained weight
Hmm.
during work. And what that really was just a softening, a resuppling of the muscles as the axial skeleton becomes more stable. Muscles release chronic tension at the exact same exchange rate. And
Right.
it's dynamic. It's always going to happen. That's just how the body works. So when I can help stabilize the axial skeleton, even if it's just left to right, it releases a tremendous amount of that tension. And from our perspective, you quit seeing the ribs. You see the abdominal wall relax. You see the
Hmm.
back soften. So instead of having like prominent withers and the ribs showing and a tight little engaged abdominal wall, sucked up tummy, it's like everything just sort of lets go and gets plumper.
Yes.
And I think maybe we need to sidetrack for a second to even talk about what muscular suppleness means versus contraction, because people don't understand that suppleness means you have restored circulation
Mhm.
out into the capillaries of the muscle. So the whole muscle is now flush with blood and full. And that's what makes it soft and mushy. That's what we call supple or flexible,
Yeah,
right?
I like to call it available. It's nurtured, it's healthy, and it's available to do what it's supposed to do.
Right. Where when a muscle contracts, the first thing it's going to do is restrict circulation to the outer capillaries, right? And so circulation depletes and doesn't feed the muscle. And the tighter the muscle gets, the more and more it restricts that blood circulation and lymphatic circulation as well.
Affects the whole system,
Right.
really.
So a tight muscle is like a flattened muscle. It's like a dried out, flattened muscle.
Like a guitar string to me.
I was thinking beef jerky.
Beef jerky. Okay.
Yeah, but if you think of a chronically tight muscle or when a muscle is overly contracting, it's sort of flattening and the circulation is decreased. So it gets harder, and we could
Mhm,
even think in terms of drier because there's just
mhm.
not that circulation. And so the way we feel it, if we palpate muscle, and somebody showed me this who was a chef. I never knew this, but if you want to cook your steak perfectly, right? Whether some people like it rare or medium or well done or medium well, whatever, right? That if we take our hand and we loosely make a fist, close our fingers, the muscle right at the base of our thumb joint between our index finger and our thumb, right?
Mhm,
When our hand is sort of relaxed and loose and you push on that, it feels like raw meat, right? It's
mhm.
all soft and mushy. That's a supple muscle. If we make a light fist, we can feel that muscle has a little more tautness or
Right.
tension. That would be medium rare, right?
Great cooking experience.
I know. I was like so flabbergasted when a chef told me this, that that's how. So when the meat's cooking, if you press on the meat and it feels, now if I tighten my fist a little more, then I feel less rebound, right?
Right. There's nothing available.
So it's decreasing the circulation, and that's how I know my steak is now medium, right? And then if I make the tightest fist possible, that same muscle is going to have very little rebound. I'm going to have to press hard on it to get any give. That's a well done steak. So I go, oh,
Fair.
so a chronically tight muscle feels like a well done steak, right? Which
Hmm.
makes sense, no circulation. And a healthy, supple muscle, if we palpate it with our fingertips, it feels like raw meat. So it kind of
Hmm.
jiggles. It has a lot of rebound. It's soft. It's mushy. That's a healthy muscle. That's a supple muscle with
Hmm.
full circulation. And so even when we're grooming our horses, and I show people this when they don't understand that their horse is chronically tight, even though the body worker says this muscle's tight, that muscle's tight, people don't know for themselves what that means.
Right.
And I go, if we put our hands on our horse like we were grooming, we can start to compare like the top of the neck to the bottom of the neck, right? We
Hmm.
can touch around the head or the poll and go, does it feel like raw meat when the horse is just standing still at rest? If it feels like a well done steak, then that's where your horse is holding chronic muscular tension.
Hmm.
So even up around the pole, I go, that can give horses headaches. It can lead to
Hmm.
TMJ issues. It affects tooth growth, tongue use, all of that.
Right.
Hyoid bone, softening the jaw, all of the things we talk about. I go, if that's holding with chronic tension, good luck.
Right.
And it's holding there for a reason. And the reason it's chronically tight is because of how the skeletal coordination is affecting it.
Right.
So when we get
Because
to the barrel, I go, sometimes I'll palpate, right? And if I see ribs, usually the muscles around the back or the abdominal wall are going to feel at least like medium to medium well.
yeah.
And so, what I'm talking about, watching the horses that are labeled as hard keepers gaining weight, quote unquote, while I'm working them, is just a resuppling of the
Right.
muscles.
That's a
It
reorganization.
So the circulation is increasing back into the muscles because they don't have to work so hard. And that gives the effect of gaining weight because it's plumping the muscles and
Hmm.
restoring that soft suppleness to them.
Yeah.
And like you said, a supple muscle is available,
It's available to move.
or it's available to contract, but
Yes.
not hold the contraction
Right.
and release the
Function as a normal
contraction.
muscle.
Right,
Contract and release, contract and release.
right. So I also want to add before we move on to the shoulders and neck that you know as well as I do, tons of people think the horse is lifting the back when they see the abdominal wall contract. And you can see that line. There's like a groove at the base of the rib cage. When the
Mhm.
abdominals contract, that groove along the base of the rib cage increases, gets deeper, right? And everybody thinks, oh, we're getting a six pack like a human, right? That's a good thing. And think that that contraction of the abdominal wall must be what's pushing the back up.
It's a good theory.
But it's
It's not true.
it's not true. It's
It's not true.
slightly more complicated than that.
Yes, it is.
And if we reach all the way back to that Horse Geeks podcast episode where we reviewed
That
that
article.
paper, the abdominal muscles contracting are supposed to resist the spine dropping, but they can't push the spine upward. They're not
That's
strong
the
enough.
easiest and simplest way to explain it. Yep.
Yeah, yeah.
Yeah.
So
They
it does,
support, they're a support, not a lift.
right. They're an antagonistic muscle group,
Mm-hmm.
which means they can resist but not uh, get the job done.
They can't lift. That's it.
Right, right. Okay, let's move on to the shoulders and neck. Anything you want to say about shoulders and neck on horses? Like, how would you assess? Because we already talked about the whole base narrow thing with the front legs
Hmm.
close together.
Right.
That's going to be tightness in the transverse and the oblique muscle groups.
Hmm.
But what
I
other,
like to look at, and we did this we drew it, but to simplify it, I first look at, does the neck look like the torso? If it doesn't, in length, if it's disappropriate, then I've got muscle tension in the neck.
so if the neck looks too short for the
Hmm.
back? Yeah.
Yeah.
And a lot of
That's
people,
just a bingo to me, and I see it everywhere.
yeah, and you hear those
It's everywhere.
comments like, my horse is really long in the back.
Yeah,
And I go,
that's a good one.
long in the back equals short in the neck. It's the same thing. It's just how we perceive it.
Right.
But it's the same problem. When somebody says, my horse has a really long back, or that horse has a really long back, what we're also seeing is a
Mhm.
lot of contraction in the neck.
Yeah.
Yeah.
And I mean, we can dig into specifics like I don't know if we've talked about it, but when you see flexion at C2 to C4 instead of at the pole, that's a definite to me
Right. So what we
things
call
aren't quite right there.
dropping the pole.
Yeah,
Yeah.
dropping the pole. So the
Dropping
pole,
the pole.
and everybody, if you, I see it all over dressage that this is a big habit. that the flexion is not at the
Nope,
pole.
it's
It
farther
is,
back.
it's farther back, and that's not good stuff.
Well, that just tells you how hard the muscles of the forehand are working. And
Working. Yeah.
and I go when I show people how to do that sort of raw meat versus well done meat palpation on a horse's neck, there are horses you could bounce quarters
Yeah.
off their
And
neck.
they don't want, some of them don't even want to be touched
No,
when it's that tense.
no, and
It's like, that's a
especially,
no-go.
yeah. And the neck will get these sort of unnatural
Yep.
highs and lows.
Waves.
Yeah, and I call it a sea serpent neck because it no longer looks like a graceful, like a healthy horse's neck sort of just grows out of the withers up to the head, and
Yeah.
it's more the shape of a rainbow.
That's a
And
good one.
and I go, so I want to see kind of a rainbow shape of the neck growing out of the back. And what we see most often, especially with these dropped poles, is kind of a sea serpent shape. Like
Hmm.
it'll be low at the pole and then high in the middle of the neck, which we call a crest,
The crusty neck. Yep.
right? And then it'll be dropped down low again just in front of the withers.
Yeah.
So
I
what,
call that, a lot of people say, oh, that's from the blanket.
yeah,
Not,
not really.
not
Unless the blanket is really heavy and
like a
irritating
couple
that
hundred
spot.
pounds.
Yeah, yeah. No, that's usually the horse sort of trying to use the neck to pull the forehand upward,
Mhm.
just like if we did the same thing. And a
Right.
lot of times, I say most often, a horse with that crest in the neck, they're told that the horse is too fat. That, and it is a place where horses will show weight gain is through the neck. So there's a lot of
Right.
truth to that. But if you palpate it and you could bounce quarters off of it, you have more than a weight problem. And maybe you
Right.
don't have a weight problem. Maybe you have a chronic muscle tightness problem. And horses that have laminitis with severe rotation of the pedal bone usually have a combination
Hmm.
of being overweight and really tight in the neck. And that's why that crest just never goes away because
Right.
it can be a combination, even if the horse loses weight. And what really opened my eyes for the first time to go, that's not a weight issue,
Yeah,
was a
Stephanie, I don't know, in some of Stephanie's podcasts she's done with you, sometimes those fat pads or that cresty neck can actually just be a sign of inflammation,
right, which could
not
be
necessarily weight problem, but an inflammatory response to something.
so it can, that's how it's related to metabolics because it
Yeah,
could be an inflammation response to the diet.
right.
But inflammation can also be the result of chronic muscular tightness.
Yes.
Same
Chronic
thing,
muscular overuse.
overuse. And
Hmm.
so the first time I questioned that it was only related to too much weight was when a horse that had been a stray of all things. So animal care and control took 3 days to catch this loose horse. Nobody claimed this horse. And she was almost starved. She was so skinny. It's a body condition score of a 1 right
Hmm.
before they starved to death, right? So she had a body condition score of a 1 and a cresty neck.
Hmm.
And I go, it's not weight.
Right.
How is this possible that this horse has a crest in her neck and she's way underweight? So I go, it's not just weight. I'm not saying it's never a weight issue,
Right.
but I'm saying it's not
It can
just
be
a weight
many
issue,
things to question.
right?
Yeah.
And again, when you could catch her, you couldn't touch her there because it was so tight and uncomfortable.
Yeah.
And so that cresty neck is why some horses have a problem sustaining the posture of long and low. They can't really
They
lengthen
can't
their
let
neck
go.
because it's so tight, it's
Hmm.
uncomfortable to lengthen the neck.
Yeah. It
And that
takes a long time.
it becomes kind of a catch 22. And so
Hmm.
horses that are overweight and tight through the neck are just what I call the perfect storm
It is the perfect storm.
for bad laminitis,
Hmm.
like the most severe kind of laminitis. So addressing dietary inflammation, allergies, and chronic muscle tightness are the only way to start turning that around.
Exactly.
And the only way you can address that chronic muscle tightness is changing skeletal coordination.
Yeah.
I go, that's the only way to get rid of it and change it forever. You can massage it all you want if the horse lets you, but it's barely going to make a dent because without that tension there, they would
Right.
fall over. They can't function.
Right. It's to me that what working with horses, that is what takes the longest is that release of that neck.
Yeah, because horses have to use the neck a little bit like an appendage,
Right.
even though it's part of the axial skeleton. Horses can adjust the use and the muscle tension in their neck when they lose balance through the torso.
Right. So
That's
it's a big deal. Slowly it can be changed. It
You have to
just takes
balance and
time.
stabilize the torso and the
Yes.
hindquarters
First.
for the
Yeah,
neck
for the
to
neck to let go.
finally let go.
And and people don't realize that. A lot of people go to the neck first
Yeah.
and it doesn't work.
No. You even did that to me. I was very tight in my neck, and every time you went to work on my neck,
You're
I'm
like,
like, don't touch it. Yeah,
no,
just
no,
don't
no,
touch
no,
it.
don't go there.
Yeah. Yeah, because I was basically like a horse with a dropped back was my habitual posture.
That's a good way to put it.
I was one of those hard keepers,
Yeah, you were.
just tight everywhere.
Hmm.
And
Good point.
changing that, it's like finally my neck even released the more I stabilized my spine and
Mhm.
pelvis. Absolutely.
Yeah, it's kind of like what I tell when I used to teach at a massage school. It's somebody may be saying this is where I hurt, but you have to go somewhere else first
Yeah.
and fix coordination to get that to release that tensegrity structure.
Right.
You've really
So
got to respect that.
where we can palpate the tightness and the root cause of the tightness can be
Mhm.
two very different
Vi-
locations in
I'm
the
going to
body.
say at least 90% of the time that's a yes.
Wow. Yeah.
In when I'm in human body work. And you think of it as, say, I get, of course, a lot of neck. Say that this pain in your neck is like a knot in a rope. If I go squeezing on both ends of the rope by massaging that spot, what am I doing?
Making it tense.
I'm making it tighter.
Yeah.
Yeah, so you've got to go to the function of what are you doing to cause this?
Well, and as a trainer, a big source of frustration when I'm working with a client on changing coordination is if a massage therapist or somebody comes in and wants to loosen all the tight spots manually,
That's
right?
a scary thing right there.
What happens is the tight spot was kind of holding that horse together
Hmm.
and keeping the horse stable. So when we manually manipulate that tension to the point that it goes away, that day or within a few days is where the horse is highly prone to injury.
Yes, I completely agree. Same with
Or
people.
the rider gets hurt because the horse stumbles or loses control
Hmm.
without that tension kind of keeping everything
Together.
glued together for now,
Hmm.
right? And
Completely agree with
so
that.
if you just go in and take away the tension, what you have is massive instability because that was what was keeping the body stable. And so it can be kind of hazardous to our safety and our horse's
Hmm.
safety to overly manipulate tight muscles. I go,
And
that,
horses are prey animals, and if they lose that stability, even if it's dysfunctional,
oh, yeah, it's a
that
panic.
is huge for them.
Hmm.
I've
Yeah.
seen some horses go into chronic pain,
Yes.
just all over, like I can't sustain because I don't have the same resources.
Yeah. And if you think about it, a foal is off the ground in an hour.
Yeah.
I go humans, it takes about a year, but it's like
We're kind of slow.
we're kind of slow. So that being able to stabilize the body, like little
It's a big
foals
deal.
are figuring out right away how to find that skeletal coordination and muscle use to just
Hmm.
stay upright and keep up with the herd very quickly.
Yeah,
So when you take that away from a horse, it's a big ass
it's a
deal.
big deal. And that's why changing coordination takes so long
Hmm.
to get healthy coordination. It's not 30, 60, 90 days. It's a lifetime.
It's a gradual transitioning.
Yeah.
And I find you get rewarded every step of the way, which is what
Hmm.
keeps us all going. But it is kind of a lifetime lesson to really master coordination. So it's just something you work on all the time, but you get to reap the benefits of it kind of from day one.
True.
So, anything about the shoulders? Oh, I know what I wanted to say about the shoulders and tightness through the thoracic sling is that again, all of that is happening because the back and hindquarters are unstable.
Exactly.
So all of that tightness that people are talking about online using
Hmm.
ground pulls and lateral leg movement, trying to supple the thoracic sling, I go again, if you're artificially trying to supple where the body needs stability, and that's why it's tight,
That's why it's tight, right?
be very, very
Very
careful.
careful. Very careful.
Yeah, it can be an accident waiting to happen,
Hmm.
where the long term, addressing the root cause, the long term solution is the spine and pelvis need more stability so
Exactly.
that the muscles through the thoracic sling, which tie closely into the neck, can release excessive tension. And it does
Yep.
that naturally.
When the coordination starts to get close to where it needs to be, it happens.
And it's kind of instant. What I find is increasing skeletal stability, like just getting the midline of the horse and the hindquarters less wiggly, more stable. That exchange rate from skeletal stability to muscular stability is instant and equal,
Hmm.
right? So if we talked about adding weight to the bones, skeletal stability, then for every pound of weight that the spine and pelvis are now managing, it's releasing 1 pound of muscle tension in the
Yeah,
opposite
that's a
direction.
good way to look at it.
And so even that exchange rate can be a little tricky window, right?
Hmm.
Because it's happening instantly. So there can be lots of little places where the bones aren't quite as stable as they need to be, but the muscles are no longer as
Right.
stable as they used to be. And so everything can get a little hairy for these
That's a
short
good
periods of
point.
time.
Because what I see with people and horses, more so with people, is they go from too much tension to nothing,
Right.
that Gumby and tripping and falling
Yeah.
and discoordination, to actually starting to find levels of healthy tone.
Yes.
Yeah.
That's exactly what
That's
horses
the
do.
cycle I see. The tension goes away. And this happened to me in Alexander School. The first year, I didn't know how to walk, chew gum, talk, ride.
Yeah.
It's like, and another person I was in school with who was a soccer athlete, her and I quit riding because every time I got on a horse, I went to my habitual habits and I couldn't organize. And she quit playing soccer for a year until that level of better coordination is
A little
readily
stronger.
available and
Yeah.
strong. Then you're like, okay, now I can go.
Yeah. No, and I kind of refer to it as the awkward phase because horses get really awkward, people get really awkward. And that's when I get asked questions about why is my horse dragging his toes?
Yeah,
Why is he
tripping.
tripping?
Yeah, I get that.
All of that. So, kind of palpating the muscles ourselves is a better indicator of the awkward phase because we go, okay, these chronically old, chronically tight muscles are getting softer and more supple, which means we're gaining stability through the skeletal coordination,
Hmm.
but it's kind of in that in between transitional phase right now. So that's why my horse looks so awkward all of a sudden, because people do the same thing.
Yep, they do.
Yeah. Yeah, and the other thing I hear about the shoulders and the thoracic sling that I kind of want to address is when it comes to saddle fitting or saddle placement, people think you're going to free up and mobilize and supple the front legs, the shoulders, the thoracic sling, the neck, whatever you want to call it. Anything from the withers forward is going to be helped by sliding our saddle behind the scapula, right? So putting our saddle not where it should
That would
be,
be
but a
like
little
riding on their
farther
butt.
back. So
I mean, if you really look at healthy scapular movement, there's a huge range of movement
well, and
in a scapula. It should be.
that's what saddle fitters were showing people. So if you take a horse's front leg and you pull it straight forward, the
Hmm.
scapula moves way back. The top of the scapula moves way back into the
Hmm.
back, right? And that's the reasoning behind placing the saddle 3 fingers behind the scapula.
Interesting.
But what that's doing is it's putting the billet straps, which the girth attaches to, back on the wider part of the barrel,
Hmm.
not the heart girth, which is the
Right,
narrowest part of the barrel just
right.
behind the front legs. So it slips once the horse starts moving.
Hmm.
It's going to gravitate forward to the narrower part of the barrel. You can't get the girth tight enough. The saddle's moving all
Moving
over.
all the time. Then we put the breastplate on.
And the other thing it does is if I'm placing a saddle behind the scapula to free up the scapula, I'm also inadvertently, and this is what most people don't notice, is I'm placing the back of the saddle now past the last rib,
Yeah, that's scary right there.
which is where most of our weight is. And
Hmm.
so now we're compressing the horse's low back, which is just as vulnerable as our low back,
Hmm.
rather than keeping the saddle and our weight over the rib cage, which is where it's meant to sit. So I see a lot of tight and damaged low backs in that scenario. And
Hmm.
even to the point where the first thing that'll happen is without the saddle on from the withers, you'll see the back go down because it's
A little
tight,
divot. Hmm.
and then it'll go
A
up
bump.
a bump before it gets to the hindquarters. And that little bump are all the low back muscles working super hard to try to stabilize the lumbar and deal with the pressure of a saddle that's too far back past the rib cage. And so if they run out of muscular energy, then the lumbar spine starts to throw out more bone and you get what's called a roach. A
Hmm.
roach is like a little bump, a bony bump along the
Right,
lumbar spine somewhere behind the saddle. And what that tells you is there's way too much weight and concussion behind the rib cage. And so I see it in all kinds of horses that muscle, you can see it, like it kind of rises up like a bump on the low back first, and it's rock hard or well done. Oh, I think you froze. And then if the muscle atrophies or gets weak, you get a bony bump.
hmm,
And all of that is with the idea to let the scapula move freely. And I go, look, the front legs are designed to be mobile. They're far more adaptable than the rib cage, the thoracic spine, and definitely more mobile than the lumbar spine.
right,
So if I have to take a pick on where to place a saddle, I'm going to inhibit the scapula. They can deal with that
right.
compared to the lumbar.
Yeah.
And then your saddle won't slide because the girth is in the narrowest area of the chest rather than the wider area. So that's the only thing I wanted to say about, I guess, the muscling kind of up and down the horse and
Hmm.
how we can feel the tightness
Hmm.
what tightness looks like is
Hmm.
muscle definition. So
Right.
when
It's
we,
that comparison we talked about at the beginning. Does one piece look shorter or longer than the other? Just simple things like that.
even more than that, like when we think a horse is really fit, like a person is really fit when we can see muscle definition, when some
Hmm.
muscles stick out, right? And we can see grooves or indentations around the muscle.
Right.
And in a horse, that just tells me how tight the horse is. Because a healthy horse, from nose to tail, looks like one long, smooth, uninterrupted muscle. We don't see muscle definition when the muscle use is healthy. So when I see a horse with a lot of muscle definition, it speaks to me of stress.
Stress of some kind.
Could be physical, mental, emotional,
Emotional,
dietary,
diet. Yep.
whatever, but there's
Yep.
some level of stress that's become chronic in that body because I can see the muscle definition. And people just perceive that as a good thing, not realizing it's a sign of chronic stress with a lot of overworked muscles.
Right. Muscles being used improperly.
Yeah. And I don't know if that's just different between horses and people. I go, people love to see muscle definition in people. That's why
Hmm.
bodybuilding is a sport. But I go, I
Well,
think
and that's a whole sidetrack, but bodybuilding, when you're building a muscle, what's happening is you're tearing down muscle tissue and creating scar tissue. That's what builds muscle.
that's what gives you definition.
That's what gives you definition
Oh.
as a former bodybuilder.
So that's why it's related to stress. The horses probably has more scar
Hmm.
tissue than
Than healthy
circulation in the
tissue. And
muscle.
then it affects, if you think of all of the detoxing, if your horse is not, or human is not getting any rest, and the liver and kidneys are working overtime
Right.
because of all the muscle tissue breakdown. Yep.
Interesting.
Hmm.
Oh, anything else you want to add? I
Nope,
need to
that
get
was a
going.
lot.
That was a lot. Thank you guys for
Sorry,
joining
guys.
us. Yes, I know we ran over a
We
little
got a
bit, but
little geeky there.
very geeky, but hopefully kept it kind of
Yep.
practical. You can go out and touch your
Touchy
horse,
feely.
touchy-feely,
Touchy
see if your
feely.
horse feels more like raw meat than well-done steak. And
Okay.
I hope that helps you guys. All right.
All right.
Thanks for joining us. We look forward to seeing you on the next episode.
Bye.
Bye, everyone.